Hi friends, welcome to the channel The Nerds. Here we are discussing about 25 easy nursing questions and answers. We have included general nursing and aptitude questions also. It will be helpful for preparing AIIMS NORCET and JIPMER nursing officer exams. So if you are not subscribed to our channel, please subscribe. And also one more thing, if you are interested to join in our model test series for AIIMS NORCET or JIPMER nursing officer exams, you can download the Android application, the Nurse Academy from Play Store, and you can join with us. We will go to our topic, that is 25 easy nursing questions and answers. First question, the passive immunity is obtained by injecting vaccines, antibiotics, antibodies, antigen. Correct answer, antibodies. So I will explain what is active and passive immunity. Active immunity means it is attained by exposure to a pathogen. So after exposure to a pathogen, or sometimes after exposure with any infections, the person's body will make antibodies. So like that, a patient will get immunity against that particular pathogen. So that kind of immunity is known as active immunity. But in the case of passive immunity, the immunity is acquired when injecting already made antibodies. So in the passive immunity, the antibodies are made from outside the body. Then it is injected into the person's body. So that kind of immunity is known as passive immunity. But passive immunity provides immediate or quick response to the infection. But the duration of passive immunity will be shorter when compared to active immunity. Vaccination and all is based on active immunity. In vaccination, the vaccines are inactivated viral or bacterial material that is injecting into the body. Then body will make antibodies against that particular pathogen. So there will be active immunity. Next question. Exchange of gases between the blood and cell is oxygenation, external respiration, internal respiration, excretion. Correct answer is internal respiration. Here exchange of gases between blood and cells. So oxygen will transport into the cells and carbon dioxide will transport from cells to blood. So that respiration is known as internal respiration. There is another respiration, external respiration. External respiration takes place that is in lungs, alveoli, lung alveoli with blood. Oxygen will transfer into blood and carbon dioxide will receive back from blood to alveoli. So that respiration is known as external respiration. That is external air. External air. From external air, oxygen is transported into blood and carbon dioxide transporting from blood to alveoli. Third question, the area which is known as blind spot of the human body. Macula lutea, Fovea centralis, optic disc, cones. Correct answer, optic disc. Optic disc means this is a diagram of eye. In the posterior part of the retina, the optic nerve is starting. Optic nerve is starting. That point is known as optic disc. From retina, the optic nerve is starting from retina. That part is known as optic disc, where there is no cone or rod photoreceptor cells. That is why it is known as blind spot. There is no rod or cone photoreceptor cells. At the same time, macula lutea means it is very packed with the area. It is packed with cone cells, photoreceptors, cone cells. So where the vision will be more. Because of highly packed with the cone cells, the vision will be more. That area is known as macula lutea. In the macula lutea, the central part, where is very large amount of cone cells are occupied. That area is known as fovea centralis, the central part of macula lutea, where the very large amount of cone cells are equipped. So that area is known as fovea centralis, where is maximum vision will be available. If image is focused on fovea centralis, the vision will be clear. Same time, the image focus is located at optic disc, then there will not be any visible, there will be no vision. That is why blind spot and difference between blind spot and fovea centralis. Fovea centralis is maximum vision. Optic disc means there is no vision. If image is developed at optic disc means that you will not get, you are not able to see any part. Next question, drug of choice in theophylline poisoning or antidote of theophylline. Hydrocortisone, phenobarbital, thyroxine, codeine. Correct answer is phenobarbital. Theophylline poisoning, we can use antidote phenobarbital. Theophylline is used to prevent and treat wheezing, shortness of breath and chest tightness caused by asthma, chronic bronchitis, emphysema and other lung disease. It relaxes and opens air passages in the lungs, making it easier to breathe. It is a bronchodilator and it is used to treat asthma, shortness of breath, chest tightness caused by asthma, chronic bronchitis, emphysema and other lung disease. If it is given in overdose, we can use phenobarbital. Next, who is the CEO of Tesla Motors? Jeff Bezos, Elon Musk, Tallulah Relay, Justin Musk. Correct answer, Elon Musk. Tesla is an American multinational automotive and clean energy company headquartered in Austin, Texas, that is in USA. Tesla designs and manufactures electric vehicles, battery energy storage from home to grid scale, solar panels and solar roof tiles and related products and services. And it also manufacturing the satellite equipments and all. So Tesla is a very large upcoming company. So the CEO of Tesla is Elon Musk. Sixth question, vasodilation of blood vessels of skin causes heat loss, heat production, no effect on heat loss or production, hypertension. Correct answer, vasodilation of blood vessels of the skin causes heat loss. Blood vessels leading to the skin capillaries become wider, they dilate, allowing more blood to flow through the skin and more heat to be lost to the environment. From core body temperature, it will move into a periphery, that is in skin. So from there, the heat will lose into a environment. Same time, vasoconstriction means there will be chance for hypertension. So in the case of vasodilation, there will be hypotension and heat loss. Seventh question, anterior pituitary is also known as adenohypophysis, neurohypophysis, stalk, intermediate lobe. Correct answer is adenohypophysis. Anterior pituitary is known as adenohypophysis. Posterior pituitary is known as neurohypophysis. Pituitary is a major organ of the endocrine system. The anterior pituitary also called adenohypophysis or pars anterior. Anterior pituitary is also known as adenohypophysis or pars anterior, is the glandular anterior lobe that together with the posterior lobe makes up the pituitary gland. Pituitary gland other name is hypophysis, anterior pituitary adenohypophysis, posterior pituitary neurohypophysis. So you are getting more multiple choice questions answers. Anterior pituitary other name adenohypophysis and one more name is there, pars anterior. Other name of pituitary gland, that is hypophysis, Other name of posterior pituitary, that is neurohypophysis. So here is the diagram. Anterior part of the brain, and in the inferior side the pituitary is located, that is near the brainstem, and this is the zoomed part of the pituitary, anterior pituitary and posterior pituitary. It is connected with the pituitary stalk, and hypothalamus is located above the pituitary gland. And anterior pituitary secretes prolactin, growth hormone, adenocorticotrophic hormone, luteinizing hormone, follicle stimulating hormone, thyroid stimulating hormone. Same time, posterior pituitary secretes oxytocin and vasopressin. For this, and one more thing, hypothalamus. Hypothalamus is secreting releasing hormone. From hypothalamus, this releasing hormone will give message to anterior pituitary to release its hormones. Then only pituitary will release these pituitary hormones like prolactin, growth hormone, adenocorticotrophic hormone, luteinizing hormone, FSH, TSH according to the need, according to the condition. Eighth question. Fentanyl is an anti-epileptic, a non-steroidal anti-inflammatory drug, an anti-tubercular drug, a synthetic opioid. Correct answer is fentanyl is a synthetic opioid. Synthetic opioid means man-made opioid. So fentanyl, it is used as an analgesics, or it is also used as a combination with anesthesia drug to increase the duration of anesthesia. Mostly fentanyl will use at operation room, in intensive care unit, that is ICU, or in casualty emergency department. Because fentanyl, if it is using, or if it is used as a if it is overused, means there is a chance of getting respiratory depression. So that is why it should be used under controlled area only. And I told you it is a synthetic opioid, that is man-made opioid. There is a natural opioid that is commonly using in our ICU setup, operation room and all, that is morphine sulfate. So compared to morphine, fentanyl has lesser side effects. That is why it is using very commonly, because respiratory depression chance is very less when compared to morphine. Ninth question. A drug that relieves itching is antiseptics, antipruritic, anti-infective, anti-inflammatory. Correct answer, antipruritic. A drug that relieves itching is antipruritic. Antiseptics means the solution or the medicines that is prevents the bacterial growth, that is known as antiseptics. The solution or medicines that prevents or that checks growth of bacteria, it is known as antiseptics. Same time, anti-infective means to prevent or treat infections. The medicines that used to prevent or treat infections, that is known as anti-infectives. Anti-inflammatory means the medicines that used to treat inflammation. 10th question. Which of the following disease is also known as Hansen's disease? It is easier question. Tuberculosis, gonorrhea, syphilis, leprosy. Correct answer is leprosy. Hansen disease is also known as leprosy. Hansen disease, also known as leprosy, is an infection caused by slow-growing bacteria called Mycobacterium leprae. It is an example of acid-fast bacilli. It can affect the nerves, skin, eyes, and lining of the nasal mucosa. So, here the other name of Hansen disease, that is leprosy, or leprosy's other name, Hansen disease. It is caused by Mycobacterium leprae. It is an example of acid-fast bacilli. To detect the presence of acid-fast bacilli, we need to do Seal-Nelson method test. This Hansen disease or leprosy affects nerves, skins, eyes, and the lining of nasal mucosa. 11th question. In following, which is not a sexually transmitted disease? It is also another easy question. Chancroid, syphilis, fibroid uterus, AIDS. Correct answer is fibroid uterus. Apart from fibroid uterus, all others are examples of sexually transmitted disease or STDs. Other STDs, sexually transmitted diseases, are chlamydia, chancroid, that is already told, genital herpes, gonorrhea, HIV or AIDS, HPV, human papilloma virus, and pubic lice. Pubic lice also considered as a sexually transmitted disease, syphilis, trichomoniasis. These are the examples of sexually transmitted disease. 12th question. Causes of urinary retentions are following except urethral obstruction, pressure on the bladder by fecal impaction, poor fluid intake, use of diuretics. Correct answer, use of diuretics. Diuretic is used to increase the urine production. All other options are that will cause urine retention apart from use of diuretics. 13th question. Taste buds of sweet and salty taste are found at the tip of tongue, at the sides of tongue, at the back of tongue, at all sides of tongue. Correct answer, at the tip of tongue. So here is the example, the taste buds distribution. So in the tip area, that is sweet part is at the tip, and sides, anterior sides, side part and the tip, that is both sides, that salty buds. Then posterior part side, bilateral sides, sour buds. Then posterior part of the tongue, that is contains bitter buds, bitter taste buds. So this is the distribution of taste buds. Anterior part, that is sweet, and anterior lateral side, that is salty, and posterior lateral sides, that is sour, and posterior part, that is bitter taste buds. Then 14th question. The International Tiger Day is celebrated on July 29th, July 31st, August 1st, August 3rd. Correct answer is July 29th. Next question. A substance which causes a rise in body temperature is called pathogen, pyrogen, allergen, none of these. Correct answer, pyrogen. A substance which causes rise in body temperature is called pyrogen. Pathogen means any organism or substance, especially a microorganism capable of causing disease. Allergen means any substance that cause allergies, allergic reactions. 16th question. Paul Bunnell test is used to detect infectious mononucleosis, rheumatic fever, arthritis, TB. Correct answer, infectious mononucleosis. Infectious mononucleosis, it is also known as mono disease, or it is also known as kissing disease, because it is usually transmitted through saliva. And one more name is there, glandular fever. Infectious mononucleosis is having three names, but first one is mononucleosis, second one is kissing disease, third one is glandular fever. The test used to detect infectious mononucleosis, that is Paul Bunnell test. The virus causing infectious mononucleosis is Epstein-Barr virus. The main symptoms of infectious mononucleosis includes fatigue, fever, rashes, swollen parotid glands. 17th question. The diagnostic aid which is done in case of meningitis is thoracentesis, abdominal paracentesis, lumbar puncture, bronchoscopy. Correct answer, lumbar puncture. In the case of meningitis, yes, doctor will do lumbar puncture to analyze CSF. So these are the examples of lumbar puncture procedures. Lumbar puncture we can do with side lying position. So the patient has to lie down on the lateral side and make a C shape. The knee and back to be bent and form like a C. Or it can also done with the sitting position. So for lumbar position, lumbar puncture we can do either by lateral lying position or with the sitting position. 18th question. In a female with infertility, which drug is used to induce ovulation? Clomiphene citrate, follicle stimulating hormone, gonadotropin releasing hormone, all of these. Correct answer, gonadotropin releasing hormone or GnRH. It is produced usually by hypothalamus. But in the case of infertility, the doctor will inject or provide gonadotropin releasing hormone to induce ovulation. 19th question. Which Indian won the first gold medal in Commonwealth Game 2022? Bindyarani Devi, Mirabai Chanu, Guru Raja Pujari, Neeraj Chopra. Correct answer, Mirabai Chanu. Mirabai Chanu has won the India's first gold medal at Commonwealth Games 2022 in the women's 49 kg weightlifting category. She aggregated a total to 201 kilogram, that is 80 kilogram plus 113 kilogram. 20th question. Prolonged suctioning of the tracheostomy may cause anorexia, nausea and vomiting, hypoxia and cardiac arrest, myocarditis and endocarditis. Correct answer, hypoxia and cardiac arrest. If you are doing suctioning, tracheostomy suctioning or endotracheal suctioning for a long time, it will suck out the oxygen from lungs. That will leads to hypoxia. If hypoxia, prolonged hypoxia will leads to cardiac arrest. So the endotracheal or tracheostomy suctioning duration should be maximum 10 to 15 seconds. Twenty-first question. Which country holds Guinness World Record in fastest road construction? Qatar, China, Ireland, India. Correct answer, India. Union Minister Nitin Gadkari announced that India holds the world's record for fastest road construction. India has entered Guinness World Record by building a 2.5 kilometer 4-lane concrete road within 24 hours. It also built 25 kilometer bitumen Solapur Bijapur road within 24 hours. A record construction of 37 km per day was achieved in financial year 2020-21. 22nd question. Sensory neuron is also known as afferent, efferent, synapse, none of this. Correct answer, afferent neuron. Sensory neuron is also known as afferent neuron. Motor neuron is also known as efferent neuron. Synapse means that is a junction between neuronal dendrite with axon. So it is a synapse means it is a junction with neurons. Afferent neuron means it is a sensory neuron. Efferent neuron means it is a motor neuron. Afferent neuron carry information from sensory receptors of the skin and other organs to the central nervous system, that is brain and spinal cord. Efferent neuron carry motor information away from central nervous system to the muscles and glands of the body. Next question. Inflammation of vagina in postmenopausal women is called toxic shock syndrome, senile vaginitis, chlamydial vaginitis, chronic vaginitis. Correct answer, senile vaginitis. Toxic shock syndrome. If you don't know, toxic shock syndrome means it is caused by Staphylococcus aureus bacteria by producing endotoxins. So this toxins will spread into blood, and it will make an severe anaphylactic reactions, and it will leads to death also if it is untreated. 24th question. The interval between exposure to infection and the appearance of the first symptom is called in latent period, incubation, all of these. Correct answer is incubation period. The interval between exposure to infection and the appearance of first symptom is called incubation period. So, what is latent period? Latent period means the time interval between when an individual is infected by a pathogen and when he or she becomes capable of infecting other susceptible individuals. So, after exposure with pathogen and the duration between the exposure with the pathogen and is capable to infecting others. That time period is known as latent period. Incubation period means exposure with the pathogen and the till the first symptom appears. That is known as incubation period. So next question. The second woman president of India is Pratibha Patil, Draupadi Murmu, Indira Gandhi, Mamata Banerjee. Correct answer is Draupadi Murmu. The current Indian president is second woman president. Pratibha Patil is the 12th president of India, and she is the first woman president of India. Pratibha Patil, she is the 12th president of India and first woman president of India. And Draupadi Murmu is the 15th president of India, and she is the second woman president of India. And she is the first tribal person to hold the president office. So Pratibha Patil is the first woman president. Draupadi Murmu is the second woman president. So that is about today's video. So thank you for watching this video. If you have any doubt means you can ask in comment section. And if you like this video means please share with your friends and click the like button. So thank you.